I will just say how much Merck More Than a Mother is important for us, Merck. As you might know, that Merck is the world's oldest pharmaceutical and chemical company, established 1668. For generations, social responsibility is part of the DNA of Merck. So we add value, we contribute to the society and scientific community. We share our commitment with all our local stakeholders to make a difference. And Merck More Than a Mother specifically is very important for me as an African woman. You might know I am from Egypt, and also as a pharmacist, and the chief officer of Merck, which is, it's my job to identify social needs and fill social gaps and cultural gaps. When I came to know about infertility in Africa, while we were doing our diabetes and cancer awareness and prevention campaign, I was speaking to women in the villages where we went in Uganda and Kenya and different places. And came to my mind that there is infertile women who had diabetes actually as a result of the stress of being infertile and mistreated and ostracized by their families and communities. And it broke my heart and made me very sad. And I said, as a leader, because Merck is a leader of infertility management, it's our role to lead the way, to help the stakeholders to define interventions, to reduce the stigma and the social suffering of infertile women in particular, and infertility in general. So I was very sad, but I also was very happy, because I was sad that I see this as a condition and the suffering of all these women, and I am a woman, I am from Africa, and I don't want to see this happening to us. But I also were very happy that to find a lot of important people and important stakeholders, influential figures like ministers of health, like Minister Sarah Obindi, like Honorable Joyce Lay, like Honorable Betty today, and this association and the parliament, policymakers, media are interested and joining the vision of making a culture shift, to change a culture of ostracizing, isolation, and mistreating the infertile women, which result in violence and physical and psychological violence, result in divorce, result in even committing suicide, like we've seen in the video in this morning. And so if we join hands all together, we will make a difference. And I was very happy to find under the same roof today, and also we're in Kenya, all these people who are joining this vision, and they want to make a difference, and they want to make the commitment to make this a change. Merck More Than a Mother will not only define the interventions to reduce the stigma and social suffering, but also will provide education for healthcare providers to better manage basic management of infertility. And not only that, also the embryologists, which are very limited number in Africa and Uganda, and only one. We are going to provide training for embryologists, so we increase the number of embryologists, which is very important to be able to have access to infertility and regulated and effective infertility care in Africa. We were going to start the first course maybe in February or March for one embryologist from Uganda, one embryologist from Kenya, in one of our partners, IVF in Indonesia. And this is not going to be the last fellowship. We will follow with other countries and another embryologists from different countries across Africa. Not only that, but we'll also support governments and parliamentarians to define policies and regulation with our also experience in Europe and in different countries, which is already led the way for regulation. We will define that, and we will support these strategies. One important topic I want to raise awareness about it, which is very important for us also as Merck More Than a Mother and as Merck, prevention. Prevention is very important. As you know, it's 85% of the infertility cases in Africa can be preventable. Why? Because it's not genetic, it is not physical. It came because of untreated infectious diseases. So if we focus on prevention campaign and we start to focus our messages on prevention like we've seen in the video today from our social media, maybe we can, within 5 years, to eliminate 85% of infertility cases. So prevention is very important. Prevention proved before the efficacy of any campaign. I mean, prevention in HIV was very effective. Prevention in different infectious diseases campaigns was very effective, and it will prove effectiveness also in infertility treatment and infertility prevention. So let us also integrate that in our healthcare sectors, with HIV programs, with mother and child programs, with maternal health programs, which is already existing as an infrastructure in healthcare. And I will ask you all to join us, our social media, Facebook, Merck More Than a Mother. So you can join and join the conversation, let your voice heard. What do you think we can do? And what is the strategy we can take? And watch our videos. We have a lot of patient testimonies to understand exactly what's happening, to also watch the success stories, and to share it with your families and your communities. Be our ambassadors today. Go out today and be our ambassadors and commit to us. At least everyone can speak to more than 10 people from their families, communities, neighbors, and then the word will spread and everyone will know that this is a campaign and we want to achieve and we want to make a difference and we want to make a culture shift. Thank you very, very much for your